Good morning, everyone. Today, I am going to talk about an important health topic: the drawbacks of using excess salt, especially for old people. Salt is something we all use every day in our food. Without salt, food tastes bland and boring. But too much salt can be very dangerous, especially for elderly people. As people grow older, their bodies become more sensitive to salt, and it can cause many serious health problems. 1. What is salt and why do we use it? Salt contains sodium, which our body needs in small amounts. Sodium helps maintain fluid balance, support nerve function, help muscles work properly, control blood pressure, but the important thing is our body needs only a small amount of salt, not a large amount. According to health experts, adults should not take more than 5 grams of salt per day, about 1 teaspoon. But most people, especially in our society, eat much more than this. 2. Why old people are more sensitive to salt. As people age, kidneys become weaker, blood vessels become less flexible, blood pressure increases easily, heart becomes weaker, bones become weaker. Because of these changes, excess salt affects old people much more than young people. 3. Major drawbacks of excess salt for old people. 1. High blood pressure. This is the biggest problem caused by excess salt. When a person eats too much salt, sodium increases in blood, body holds more water, blood volume increases, blood pressure rises. High blood pressure can lead to headache, dizziness, nose bleeding, heart problems, stroke. Many old people suffer from hypertension mainly because of too much salt in their diet. 2. Heart disease. Excess salt increases blood pressure, and high blood pressure puts extra pressure on the heart. This can cause heart enlargement, heart failure, heart attack, irregular heartbeat. Old people already have weaker hearts, so excess salt can be very dangerous for them. 3. Kidney problems. Kidneys remove extra salt and water from the body, but in old age, kidneys do not work as efficiently. Too much salt can cause kidney damage, kidney stones, water retention, swelling in feet and hands, kidney failure in severe cases. So old people must be very careful about salt intake. 4. Swelling, edema. When there is too much salt in the body retains water, feet swell, ankles swell, hands swell. Face may look puffy. You may have seen many elderly people with swollen feet. Excess salt can be one of the main reasons. 5. Weak bones, osteoporosis. Many people do not know this, but excess salt can also weaken bones. Too much salt causes calcium loss through urine. Calcium is very important for bones. When calcium decreases, bones become weak, risk of fractures increases, back pain increases. Height may decrease. Old people already have weak bones, so excess salt makes the problem worse. 6. Stroke risk. High salt, high blood pressure, risk of stroke. Stroke can cause paralysis, speech problems, memory problems, disability, death in severe cases. So reducing salt can actually reduce stroke risk significantly. 7. Dehydration. This may sound strange, but excess salt can actually cause dehydration. Salt disturbs fluid balance, and old people feel thirsty, often feel weak, feel tired, have confusion sometimes. 4. Common foods that contain too much salt. Old people should especially avoid or reduce pickles, achar, papad chips, salted snacks, processed food, instant noodles, sauces, bakery items, frozen food, canned food, even bread and biscuits contain salt. 5. Signs that an old person is eating too much salt. Some common signs: high blood pressure, swollen feet, frequent thirst, headache, kidney problems, shortness of breath, fatigue, frequent urination, confusion in very old people. If these symptoms appear, salt intake should be reduced. 6. How old people can reduce salt intake. Some simple tips: use less salt in cooking, avoid adding salt on salad, reduce pickles and papad, avoid processed food, eat fresh food, use lemon, herbs, and spices instead of salt, drink enough water, check food labels, use rock salt or low sodium salt in small amounts, Consult a doctor if blood pressure is high. 7. Conclusion. In conclusion, salt is necessary for our body, but too much salt is very harmful, especially for old people. Excess salt can cause high blood pressure, heart disease, kidney problems, swelling weak bones, stroke, dehydration. Old people should be very careful about their salt intake and try to eat a healthy, balanced diet with less salt. Remember this sentence: less salt, better health, longer life. 8. Closing. Thank you for listening. I hope this talk helps you understand the dangers of excess salt for old people and encourages healthier eating habits. Thank you.